The mouth is not just a part of the digestive system, it's also a gateway to the body. With common dental care practices like brushing our teeth and flossing, we can do so much for our health. But when we expand our routine with the right practice of oil pulling, tremendous health benefits can be achieved, from full body detoxification to immune system improvement and healing. Hi, I'm Anna and you're watching Naturally Anna YouTube channel, the place to be if you want to build a life of balance. Oil pulling is an ancient Ayurvedic practice, a part of Dinacharya or morning routine that involves swishing of a small amount of oil in your mouth for about 15 to 20 minutes. The idea is to pull the oil through your teeth and swish it around the oral cavity to help remove toxins, bacteria, and impurities from the mouth, from the salivary glands, blood vessels underneath the tongue, and even from the sinuses, while supporting the healthy oral microbiome. After swishing, you spit the oil out. The practice is first mentioned and explained in the ancient text called Charaka Samhita, dating back more than 2000 years ago, one of the most important texts in the classical system of Ayurveda. The traditional system of medicine originated in India. But this simple practice gained wider popularity in the 1990s when Dr. Karach from Ukraine at a conference of bacteriologists and oncologists presented a number of successful cases where the practice of oil pulling with sunflower oil was used for full body detoxification and healing, improving immune system function even in patients with AIDS and as a treatment for various conditions such as arthritis, asthma, migraines, etc. Scientific research on oil pulling has gained momentum in recent years, supporting the benefits of this ancient old practice on oral hygiene and general health. Knowing I don't have the best genetical predisposition when it comes to oral and teeth health, when I read about the practice of oil pulling back in my mid-20s, I immediately started swishing in the morning. The first thing I noticed was my teeth getting whiter and my gums becoming less sensitive. However, I dropped the practice until 10 years later when I experienced recessed gums during pregnancy. I noticed the formation of little pockets between the teeth and the gums as the gums began to recede, exposing more of the tooth and making them more vulnerable. I went back immediately to oil pulling consistently for a year and guess what? My gums healed. 9 years forward, I haven't had any issues with my gums nor with my teeth. Health benefits of oil pulling are much wider than my personal experience with receding gums. Oil pulling reduces plaque. A study published in the Journal of Clinical and Diagnostic Research found that oil pulling with sesame oil significantly reduced dental plaque and improved gum health. Participants who swished the oil for 10 to 20 minutes every day showed a noticeable reduction in plaque and improved gum conditions after only 2 weeks. Oil pulling whitens the teeth, prevents gingivitis, a common gum disease that causes inflammation and bleeding and can lead to periodontosis, which is an advanced stage of gingivitis that, if left untreated, can lead to the destruction of the supporting structures of the teeth, including the gums, ligaments, and even bone. It prevents periodontosis, it reduces bad breath, it promotes full body detoxification by removing toxins via the mouth, it supports healthy oral microbiome, it decreases gum inflammation, helps prevent cavities, boosts the immune system, and improves skin health. People with following conditions have reported significant reduction in their symptoms after practicing oil pulling for at least 1 week and up to a year for chronic ailments, including chronic fatigue, insomnia, asthma, headaches, migraines, eczema, kidney and liver diseases, heart diseases, mental diseases, lung diseases, arthritis, chronic blood diseases, allergies and respiratory congestions, and acne. How is it possible that such a simple, easy to do, inexpensive practice can have such impressive benefits for our overall health. Let's look at what happens in the mouth. Just like all other body openings, oral cavity is lined with a mucosal membrane that creates a barrier between the environment and our inner tissues. This barrier is a crucial first line of defense against pathogens. However, the oral mucosa is thin and highly permeable, with a rich blood supply close to the surface. Now, being warm and moist with food leftovers lying around, the mouth is a hot spot for yeast and bacteria. It is estimated that there are anywhere from 100 billion to 1 trillion bacteria living in the average person's mouth at any given time. These bacteria can be found on the teeth, gums, tongue, and inside the cheeks. Many of these bacteria are beneficial and help maintain a balanced oral ecosystem, but others can be harmful when allowed to proliferate, contributing to oral diseases such as gum disease, cavities, and bad breath. But the biggest danger occurs when there are cracks in the mucosal lining, which can happen anytime due to flossing, chewing, or any kind of gum or tooth disease, having a root canal being one of them. When this happens, the door for harmful bacteria and yeast opens into the bloodstream, and from there on to all your internal organs. Researchers have found that the same bacteria found in your mouth are also found inside arterial plaque, on the heart valves, and in the brain. There is plenty of evidence linking common mouth bacteria like Streptococcus mutans to a host of health concerns, including arterial, heart, lung, brain, and blood sugar health. Oil pooling uses lipophilic oils, meaning these oils attract other oils and fat-soluble toxins, then extracting them out from any environment oil is introduced to. Oil attracts oil, and this property to extract toxins using lipids is integral to Ayurvedic detox therapies. If you're familiar with Ayurveda, you'll know how much we love oil. As you swish the oil for 15 to 20 minutes, the blood circulation through your mouth will increase, and the majority of your blood volume will circulate through your salivary glands and the blood vessels under your tongue. This will allow the oil to extract fat-soluble toxins from the bloodstream. Additionally, and studies have shown, swishing the oil vigorously in your mouth and mixing it with saliva breaks the oil down into smaller particles, the process called saponification, now having a larger available surface for attaching to harmful bacteria. When you spit it out, it will look like a cloudy white watery emulsion, and it will be filled with harmful bacteria and toxic substances. This being said, do not swallow it. Some people will notice their sinuses draining after the practice, needing to blow their nose out, or coughing out lumps of mucus from the bronchi, meaning that oil pooling can help with mucus congestion as well. And last but not least, swishing for 20 minutes activates the muscles of the cheeks and face, maintaining the tone of facial tissue and muscles. Detox and facial yoga at the same time. I love it. So how do we do the oil pooling? First, you will need to purchase the oil. It has to be organic, unrefined, cold processed. In Ayurveda, everything needs to be individualized based on a person's constitution, imbalance, and the season. This includes choosing the type of oil and, if needed, creating formulations that are specific to the individual. But here are some important guidelines to help you choose the oil you need. Sesame oil has antibacterial and anti-inflammatory properties. With its warming and moisturizing qualities, it will benefit everyone, but especially to those who tend to have dry mouth and general body dryness, sensitive gums, cold hands and feet, and during colder months. Coconut oil has strong antimicrobial properties due to the presence of lauric acid, very powerful against a wide range of bacteria, viruses, and fungi, but particularly Streptococcus mutans and Candida albicans. Coconut oil has a cooling quality and is best for people experiencing heat-related oral issues like inflammation, It's fantastic for gingivitis, sores, or sensitivities, and during summer months. This said, you should never use coconut oil for oil pulling when feeling congested in the upper respiratory channels and the sinuses or having a cold. In this case, go for sesame oil. Sunflower oil has a relatively mild flavor compared to other oils like sesame or coconut oil, making it more palatable for people who are new to oil pulling or those who may find the taste of other oils overwhelming. It contains linoleic acid, an essential omega-6 fatty acid that has anti-inflammatory properties. This can be helpful in reducing gum inflammation and promoting oral health. It's best used by people with heavier body constitution and those who are generally hot in nature. It makes a great oil of choice during menopause. You can also add turmeric, neem, or clove powder to the base oil to enhance the anti-inflammatory and antibacterial effects, or add some fennel powder or peppermint leaf essential oil for fresh breath. I'm sharing my favorite formulation that you can use throughout the year if you wish, combining two oils to achieve a full spectrum of healing qualities. But don't overcomplicate or overthink. Start with what you have. Pick one oil and observe how your body reacts. The best time to do oil pulling is early in the morning, before eating or drinking anything. Brush your teeth first, then take 1 tablespoon of oil into your mouth. If using coconut oil, you'll let it melt for a few seconds in your mouth, and then you start swishing the oil back and forth, up and down, right and left, pulling the oil through your teeth. You can use this time to take a shower, get dressed, do your makeup, prepare yourself a cup of tea, cook breakfast, or whatever your morning routine is. If you are new to the practice, start with shorter durations, 2 to 3 minutes. Then build your practice up to 20 minutes. If this feels unsustainable, do as much as you can. Don't strive for perfection, strive for consistency. You can swish for 10 seconds, then rest for 10 seconds, then again swish it for 10 seconds, and so on. As you swish, your salivary glands will produce a lot of saliva, so the volume of the emulsion will increase. If needed, you can spit some of the emulsion out and continue the practice. After 20 minutes, you spit the oil in a paper towel and dispose it in a trash can, as you don't want to clog your plumbing, especially if using coconut oil, which will go hard and block up your plumbing. Then rinse your mouth well with lukewarm water, adding a small pinch of salt in it if you wish. Commonly asked question is whether you should brush your teeth after oil pulling. You brush your teeth before oil pulling, then rinse your mouth with lukewarm water after spitting the oil. There is no need to doing it twice, but it won't do any harm if you do. If it's for prevention only, you can oil pull on once per day, but if you're having gingivitis, periodontosis, sores, abscesses, toothache, then do oil pulling 3 times a day. I've heard so many successful stories, people healing these conditions and many more with this simple practice. They will also commonly notice how they sleep better, wake up with more ease, with less pains and aches, having more clarity, and over time noticing less inflammation and congestion in the body. If you are having dental fillings, you can do the oil pulling method, but in this case, swish the oil gently. Oral health is deeply intertwined with our overall health. Maintaining good oral hygiene not only protects your teeth and gums, but also helps prevent or mitigate systemic health issues like heart disease, diabetes, respiratory infections, kidney disease, pregnancy complications, rheumatoid arthritis, and even Alzheimer's disease. Oil pulling is a simple practice, but with tremendous effects. Will you give it a try? Let me know how it goes in the comment section below. Thanks for watching. I'll see you in the next video.